Hello, my name is Hashmi. I'm a psychiatrist. I'm board certified by the American Board of Psychiatry and Neurology. I'm currently consulting with MindX's, which is part of American TelePhysicians. Let's start the interview.
Dr. Ali, can you briefly tell us about your journey in psychiatry?
Yes, I graduated medical college from Pakistan, and then I did my psychiatry training from Baylor College of Medicine in Houston. And I worked full-time in Arkansas for about 12 years, and I've been doing it ever since.
What inspired you to pursue a career in psychiatry?
It was interesting, it was challenging, it offered a mixture of the lifestyle that I wanted and the intellectual challenge that I enjoyed.
How do you stay updated with the latest in psychiatric care?
I'm interested in reading about psychiatry, about mental health. It's become easier now with social media. You have all kinds of podcasts, you have all kinds of updates via social media. So I like to read, I like to listen to podcasts in my car. I do regular CMEs, continuing education. So I'm interested in mental health, all things mental health, so it's not difficult.
Can you explain how American TelePhysicians is revolutionizing psychiatric care?
So telehealth and particularly telemental health is no longer a new way of delivering healthcare, but it's an innovative way. It's a way that allows us to bridge geographical distances, makes it very convenient for people seeking care. So our focus remains primarily on telemental health and also on integrating various aspects of healthcare across one platform, which is a new way of doing it, really a revolutionary way of doing it.
What are the key benefits of telepsychiatry for patients?
Primarily easier to access, easy to connect to people that are at longer distances, much more convenient in some conditions where you may not be able to travel or where you may not have access to services otherwise.
How does American TelePhysicians ensure quality care through teleconsultations?
We have a rigorous process of selecting our providers. All of our doctors are board certified. We make sure that they are up to date on their licensure, and we have a strong quality control department that makes sure that people are getting the care that they need.
In your experience, how have patients responded to telepsychiatry?
I would say most people tend to be very happy with telepsychiatry because of the reasons earlier mentioned: easy access, ability to see the doctor that they need without having to travel great distances. So I would say 90% of people benefit from telehealth services. There are a few that require in-person care, and those can always be referred to the appropriate facilities.
How does American TelePhysicians address the challenges of diagnosing and treating mental health issues remotely?
So actually mental health is uniquely suited to telehealth services because we don't have a lot of hands-on work. So our work consists primarily of interviewing people and observing people and diagnosing in that way. So telemental health actually is an ideal way to deliver mental health services but in all kinds of settings across all kinds of age groups.
Switching gears to more casual questions, what's your favorite way to unwind after a busy day?
I like to work out, I like to read, I like to listen to music, I like to watch a good season on Netflix or something.
Do you have a favorite book or author?
Lots of them, too many of them to name, but recently I've been reading the Greek philosopher Marcus Aurelius, and also just started reading a novel that a friend of mine actually wrote. He's a lawyer, and it's a historical novel that he uses. So I like reading. No particular author that I can name. One particular person that I've always admired is the famous American psychiatrist Irvin Yalom, all of whose books I've read, historical novels, short stories. So I love reading.
What's one place you'd love to travel to?
I've traveled to not enough places yet, but one place that I almost made it to, but then I had to turn back because COVID hit is Japan. I would love to go to Japan and take a look around there. It seemed like a wonderful place.
Any hobbies or interests outside of your professional life?
I like to bicycle, I like to ride, I like to read, I like to travel when my time permits. So mostly those things.
Coffee or tea?
Coffee in the morning, tea in the evening.
If you could have dinner with any historical figure, who would it be and why?
Like I said, Dr. Irvin Yalom, who I call him the Freud of our times. I once wrote him an email and he responded with a one-line answer. So he's very old now. One day I might make it to California and maybe have a meal with him. I would love that.
What is your favorite Netflix's series or documentary?
Okay, so I love rewatching episodes of The West Wing, and it's election season, so that's relevant. Friends and Seinfeld are perennial favorites, and I just started watching Succession, which is quite fun.
What's a piece of advice you'd give to someone considering a career in psychiatry?
Very challenging, very frustrating, but also extremely satisfying and extremely fulfilling.